What does implantation discharge look like?
Welcome to today's video. In this video, we will discuss implantation discharge, its appearance, and some frequently asked questions.
What is implantation discharge?
Implantation discharge is a light spotting or bleeding that can occur when a fertilized egg implants itself into the uterine lining. This is an early sign of pregnancy and usually happens around 6 to 12 days after ovulation and fertilization.
How does implantation discharge appear?
Implantation discharge may vary in appearance but typically has the following characteristics. Color. Implantation discharge is usually light pink or brown. This is because it contains a small amount of blood mixed with cervical mucus. Consistency. It tends to be thinner and more watery than menstrual blood, resembling a light discharge or spotting. Duration. Implantation discharge can last from a few hours up to 2 to 3 days, but it's typically much shorter than a regular menstrual period.
How can I differentiate implantation discharge from a menstrual period?
To distinguish implantation discharge from a menstrual period, you can consider the following factors. Timing. Implantation discharge occurs earlier than a menstrual period, usually around the time you would expect your next period. Intensity. Implantation discharge is lighter and less intense than a regular menstrual period. It's often just a few drops or light spotting, while menstrual bleeding is heavier and lasts longer. Color and consistency. Implantation discharge is usually light pink or brown and thinner than menstrual blood.
Is implantation discharge common?
Yes, implantation discharge is quite common and is experienced by many women. However, not all women experience implantation discharge, and its absence does not necessarily mean that you are not pregnant. In conclusion, implantation discharge is a light spotting or bleeding that can be an early sign of pregnancy. It is typically light pink or brown in color, thinner in consistency, and shorter in duration than a regular menstrual period. While it's common, not all women experience it, and its absence does not rule out pregnancy. If you suspect you might be pregnant or have concerns about your health, consult a healthcare professional for personalized advice.